I want to show you all the ways extra weight affects your health. Now, obesity may not seem like any big deal, right? But let's look inside the abdomen. All this visceral fat hugging your internal organs affects virtually every organ system in your body. Let's start with maybe the most important one, your heart. Obesity over time can build up plaque deposits in your arteries. If that ruptures, it can lead to a fatal heart attack. The #1 killer of men and women, heart disease. Now, fat doesn't necessarily get in your lungs, but what does it do? It makes breathing more difficult because of all that extra fat that you're carrying, not only in your belly, but up here in the soft tissues of your neck. You're at increased risk for obstructive sleep apnea when you sleep at night.
When you sleep, air travels through your nose and mouth, down the throat, and into your lungs. When you are awake, the muscles are tight, keeping the airway open. But when you sleep, these same muscles relax, causing the airway to narrow. As the air passes through the narrowed opening, the uvula and the surrounding tissues begin to vibrate, causing a condition known as snoring. If the tongue continues to fall back, it will cause the breathing to become slowed or completely stopped. This is known as obstructive sleep apnea.
Common symptoms of obstructive sleep apnea are snoring, morning headaches, chronic daytime sleepiness, fatigue, irritability, and impaired concentration.
You wouldn't think that obesity would affect your brain, right? Interestingly, obese people have been shown to have brain atrophy, thought to be due to reduced blood flow. Has anyone ever walked around with massive swelling in their legs? Well, it could be due to venous insufficiency, where it's just difficult for blood to get back to your heart. If you walk around obese, your joints are more likely to become arthritic. So just walking around becomes painful and debilitating.
When we talk about the diseases of obesity, we are talking about type 2 diabetes, hypertension, lipid problems, so blood fats, if you will, heart disease. Those are sort of the big four, if you will, that constitute what we classically call the metabolic syndrome. However, we now know that there are several other diseases that fall within this scope as well. For instance, non-alcoholic fatty liver disease, the reason we're in this epidemic can be summed up with one statement: a calorie is a calorie. It's the first thing dietitians learn in dietary school. If you eat more than you burn, you will gain weight. If you eat less than you burn, you will lose weight. And it doesn't matter if those calories come from carrots or cheesecake. The bottom line is, a calorie is a calorie. You eat too much, you exercise too little, and that's the mantra, and guess what? It doesn't work. And the reason it doesn't work is because a calorie is not a calorie.
Honey, what'll these calories do to my waistline?
Relax, it's Diet Delight.
There was a big war in the food field back in the 60s and 70s. And the war was fat or sugar. And so we were remanded as a country to reduce our consumption of fat from 40% to 30%. Well, guess what? We did it. We are there. But the total consumption of calories, and specifically carbohydrate, and especially sugar, has gone through the roof. So it was that directive, that edict of the late 1970s that started the obesity and metabolic syndrome ball rolling.
It is almost impossible to buy those packaged foods without getting a lot of extra sugars that are just going to be toxic for your metabolism. I'm suspicious of anything that says low-fat or diet, because you know that that means that they've had to compensate with a lot of these added sugars.
A perfect example, snack wells. So what's a snack well? 2 grams of fat down, 13 grams of carbohydrate increased, 4 of which are sugar. No fewer calories, same number of calories. And if fat's not the problem and sugar is, you can see where we're going here. A calorie is not a calorie. Sugar is 50 times more potent than total calories in explaining diabetes rates worldwide. So you say, wait a second, sugar? Where's the fat in sugar? Sugar is made up of 2 molecules, one called glucose, which is not very sweet and not very interesting, and fructose, which is very sweet and very interesting, and it's the thing we seek, it's the thing we crave. Fructose is a chronic, dose-dependent hepatotoxin, liver toxin, which is just like alcohol. In fact, fructose, the sweet part of sugar, is more like alcohol than it is anything else. Alcohol is metabolized to fat, and so is fructose.
When you eat too many carbohydrates, you raise your blood sugar. Since high blood sugar is toxic, your body releases insulin to bring it down. But your body can only burn a little bit of sugar at a time. So what happens to the rest of it?
Your storage sites for carbohydrate are limited, and we've got unlimited storage places for fat, so the body ends up just converting the carbohydrate to fat.
Welcome cardiologist Dr. Steven Sinatra and nutritionist Johnny Bowden to the show. Welcome to both of you. So let's talk about this idea of what you're calling the cholesterol myth, and we can have a little back and forth here, because you are mainly trying to say that we're eating too much sugar.
Correct. See, that's the problem. I mean, everybody focuses on cholesterol with heart disease. Look, cholesterol is found at the scene of the crime, but it's not the perpetrator. Sugar is the villain in heart disease. That causes heart disease, not cholesterol.
At one point, there were 2 competing theories about what really caused heart disease. One was that it was fat and cholesterol. The other was that it was sugar. The wrong theory won. It was never fat and cholesterol. They're pretty minor players in heart disease. Sugar, on the other hand, as you mentioned, raises insulin resistance, increases the risk of diabetes. And when you have all those fat cells, they send out inflammatory compounds, which create more damage in the vascular walls, which really precipitate plaque and heart disease. It's been sugar all along, not fat.
Now, I'm not saying that you need to go on a completely carbohydrate-free diet and just not eat any carbs, but I do want to make the point that these carbohydrates are turning into sugar, and the sugar is then turning into stored body fat. Now, it's really important to know when to eat your big meals during the day. I would much rather you eat a big meal for breakfast and a smaller, more sensible meal for dinner. And the reason I say that is because there's been some big weight loss studies done over the last few years that have really shown that people who skip breakfast have a real hard time losing weight. And people who eat a big breakfast actually lose weight faster. When they diet, when they exercise, the weight comes off of them quicker. And the reason behind this is because if you eat more food in the morning, it gives your body a chance to burn that food off throughout the day. All of the activities that you do during the day, walking, thinking, actually your brain uses glucose, you're giving your body a chance to burn off that as fuel. But if you skip breakfast and you eat a big dinner and then you eat another big snack right before you go to bed, that food just sits in your stomach and doesn't get burned off, and it just turns to fat. So it's really important to understand, I would much rather you have a big breakfast with some carbs in the morning, like oatmeal or something like that, if it means that you're going to have like a grilled chicken salad for dinner. You know, and even when it comes to lunch, I see a lot of people eating grilled chicken salads for lunch or really light lunches. Sometimes people will bring peanut butter and crackers, but then they'll go home and they'll eat pizza and drink a bunch of Coke and then snack, eat chips right before they go to bed. So that's exactly what you don't want to do. I would rather you eat a bigger breakfast, even sort of a more nutritious lunch, and eat a very sensible dinner. One other super important thing that I want to pass along is that if you really want to lose weight, you need to completely eliminate any sort of sugary drink. So that would be things like Coke, Dr. Pepper, Mountain Dew, sweet tea, any sort of drink that has sugar in it, you want to avoid that. And instead, just drink water. If you did nothing else or followed none of this other advice and only did that one thing, you would lose weight just from that one change right there. The sugar in soft drinks is the worst kind of carbohydrate. It's the fructose that we talked about. That goes immediately into fat in your body. So that's the absolute worst thing that you can do. Now, a lot of people will ask me about Diet Coke and Splenda and Crystal Light, and I guess that's okay if you really have to have something that tastes sugary and sweet. But I'll just say it this way. I don't think I've ever known anyone who drank a lot of that stuff who was real thin. That's just in my clinical experience. I feel like people who drink a lot of Diet Coke or a lot of that Crystal Light stuff, they're not real thin people. So what I've noticed is the people who say, yep, I only drink water, those people are usually thin. Here's my take on exercise. Usually when people come in to see me and we start talking about exercise, what I usually hear back from them are the reasons why they can't exercise, and they're legit. It's things like knee pain, it's things like back pain, things like they don't have enough time, and I totally understand all that. I tell people I personally try to work out 3 times a week, but I've missed the last 1,300 times in a row. So I totally get that. And other times we get real caught up in what is better for weight loss. Is it weightlifting, or is it running? Is it biking? What kind of exercise is best for fat loss? And what I'll say is this. I personally think that if you had to pick one of the two, circuit training or weightlifting is probably a little bit better for fat burning. So here's what I tell people. Just do something. If it means going for a 20-minute walk after dinner, then that's great. If you aren't able to walk, then what I tell people is if you're sitting on your couch watching a show at night, just buy some little 5-pound or 10-pound dumbbells. to have so that at least you can work your arms out and do curls and do overhead presses and things like that.
This is a terrific article that showed that it's hard to lose weight on your own. And it showed that your body's having to overcome a lot of different things to allow you to lose weight. And one of the studies that really demonstrated this super well was the Biggest Loser study. I don't know if you guys saw this, but this was fascinating. I'm not a big fan of that show. I know that the purpose is to help people to lose weight. I'm not a big fan of how they do it. A lot of it is humiliating, and a lot of it is not sustainable. People cannot do that forever. And this is what happened to the Biggest Losers afterwards. Do you see what happened? Every single one of them regained their weight, except for one. One right there did lose weight. That particular patient actually ended up having bariatric surgery. And so this shows when you're dieting how hard it is to lose weight on your own. And these were motivated people. Don't tell me they're not motivated if they don't come on a national TV show. Those people are motivated. So it's not motivation. Now, who qualifies for weight loss surgery? As you can see behind me, it's someone who's got a BMI over 40 or a BMI over 35 with a medical problem. We want to make sure that patients are well prepared for surgery because think about it. What else do you do 3 to 4 times a day, every day? That is a difficult habit to unwind. And so that's why we have psychological support if needed. Now, these are the different procedures we offer. The band is not a procedure we do very much anymore. This procedure in the beginning was met with a lot of enthusiasm, but roughly about only half of patients are able to keep weight off with the band. The way it works is pretty simple. It's like putting a belt across the stomach, and you can tighten it up or loosen it as needed. It is a pretty safe procedure, but it is a device, and it can slip, slide, and erode. Because of that, that's led to this operation called the sleeve gastrectomy, which is now the most popular operation in the United States. And what we do with this operation is we take the stomach, that's roughly about the size of a football, and make it into a long skinny tube, roughly about the size of a banana. And you can see there that there's very little chance for having issues with vitamin deficiencies. And as you can see from the next slide, people lose roughly about 60% of their extra weight. Very low complication rate, as I'll show you in just a little bit. Now, the gastric bypass is an extremely interesting operation. This operation is truly a metabolic operation. By that I mean that it is able to not only let people lose weight, but also have them get rid of their diabetes, high blood pressure, even increase people's testosterone. In fact, after this operation, in as little as a week, people who were on insulin before are no longer on insulin afterwards. So it's a pretty remarkable operation. We're trying to figure out exactly how it works, but it is a very unique operation.
Now, I think it's worth pointing out, if you are interested in bariatric surgery, there is a bariatric surgeon here in town who is with Baptist. His name is Dr. Baker, and his office is literally right across the street from where we are. He is in the Thomas building, which is the gray building across the street. And if you're interested in bariatric surgery, he would be the guy to see for sure. And we can get a referral set up so that you could visit with him and his nutritionist.
This medication has been around for a long time. It is called phentermine. It is very safe. It's very effective. If it's approved by the FDA for 3 months at a time, it can be used off-label for longer than that. It takes away the perseverating thought, the thinking all the time about food. When you talk to people and they're food addicted or they're having a really difficult time getting the weight loss, over and over you hear that, God, they just can't stop thinking about food. And when you start them on phentermine, you find that they come back and they say, I just don't think about food anymore, which is a wonderful thing. We always check blood pressure and heart rate prior to starting phentermine. One of the risks of phentermine is that it does have the potential, because it has a little bit of a stimulant effect, to raise heart rate and blood pressure. So we check those first. Generally, I also check thyroid functions, and sometimes we'll check what's called a metabolic panel. So those are things you want to know are normal before you start people on phentermine. And then it's taken once a day in the morning so it doesn't disrupt your sleep or anything. Some people have a concern when they hear phentermine because they know the history of fen-phen. Phentermine was one of the two components of fen-phen. Fenfluramine was the one that was taken off the market. Fenfluramine did affect people's heart valve. That is the second fen in the fen-phen drug that was taken off the market. Phentermine was not the culprit and is very safe in terms of heart valves. So just so you understand the history and the difference in case you have that in the back of your mind. Well, what about that fen-phen thing that was bad?
A couple things I want to add about phentermine. Number one, of the two medications here, of phentermine and the Contrave, the phentermine is definitely the cheaper of the two medications. The other thing I want to mention about phentermine is if we do put you on this medication, I really would like you to check your blood pressures every day at home and keep a running log of your blood pressures, because this medicine does create some high blood pressure issues in some people, and that's something that we really need to pay attention to. If we do start you on that medication, the way that we do it is we have you come back each month and we check your blood pressure and we reweigh you. And I generally keep people on this medication for 3 months only, unless you're having a ton of success with it and you've lost 20 or 30 pounds and you want to keep going for an additional month. Then we just sort of take that on a case-by-case basis.
Contrave is a medication that is a good alternative for people who cannot use phentermine. So some people have problems with heart rhythms or blood pressure that really can't be overcome, and you want to use a medication that does not have heart effects or cardiac effects. So Contrave is a combination of two other medications. It is a combination of bupropion, which you may also know as Wellbutrin, and something called naltrexone, which blocks opioid receptors in your brain. And you might think, well, what does that have to do with me having problems with my weight? And the reasoning is that these receptors have a lot to do in kind of a gratification response. And so, as we all know, food is very addicting. And so blocking these receptors can tend to blunt the gratification response that often people get from eating a lot of carbs. They feel good, they crave the carbs, they want more carbs. So, but there are some things that you have to watch out for with this medication. That Contrave is a medication that has some drug interactions and side effects. The issues with naltrexone are that you certainly cannot be on any opioid medications or even something like tramadol, which goes under the name of Ultrium, when you take it, because you can run into problems with both acute withdrawal as well as problems of being more susceptible to overdose. Bupropion is a very nice antidepressant that does generally increase motivation and increase mood. That's the first medication of the two in this drug. So it's a very good alternative. It's dosed in increments over 4 weeks. The first week you take 1 tablet once a day. The next week it's 1 tablet twice a day. The third week you take 2 in the morning, 1 in the afternoon. And the fourth week, you take 2 in the morning, 2 at night, and that usually is the steady state dose.
Okay, one last thing that I want to mention is that we've got 2 registered dietitians on staff. Whitney Holland is a registered dietitian who specializes in obesity and weight loss counseling and in diabetes. Whitney leads a weight loss class about once a month, and the class is here in this building on the 2nd floor. There's a big boardroom, and usually about 5 or 6 people show up for the class each month, so that would be a really good opportunity for you, and it's totally free. That's one of the benefits of being in the Baptist Network, is that they provide a nutritionist for you for free. Now, to find out when the next meeting is, when you check out today, you can ask the front desk, and they'll tell you the next time that she's having a class. If you can't make the class, don't worry. We can get Whitney to either call you on the phone and do a one-on-one type thing over the phone, or you can come into our clinic at whatever time you want to, and Whitney will meet you here. And usually she talks to people for about 30 minutes and goes over real specific things about your diet and talks about exercise and things like that. We're also lucky enough to have another registered dietitian on our team. My physician's assistant, Leanne Griffin, is also a dietitian. And Leanne sees patients in clinic every day with me. And she's also available to be seen by appointment. So if you'd like to see Leanne, then you can make an appointment to see her.